So just to say hello to everybody, my name is Emily Donohoe and I work in the programme office here in the School of Nursing, Midwifery and Health Systems here in UCD. I'm very pleased to be comparing the event today with my colleague Anne Donohoe, who's going to be speaking later on. So I can see people are joining there, so continue on joining and we will start our presentations. Just to reassure everybody, the session is going to be recorded and made available to all those who've registered afterwards. So we're delighted to be here as part of UCD Masters Week, and we're going to give a brief overview talk today about programmes available in the school. Just to confirm, and Anne will probably repeat this primarily is for Irish residents due to the entry requirements of a lot of our programs here in the school. But anybody who's not Irish resident and is just here as an informational basis, that's okay as well. You're very welcome to stay. And we think the session will take about an hour, and we might run over a little bit based on presentations and how Q&A goes. But yeah, we'll hopefully be in and out and you can get back to whatever you're doing this afternoon. So we really appreciate your time today. So just a brief overview of what we're going to cover, and you would have seen this when you registered. We're going to start with an introduction to our talk graduate programs here in the school from Dr. Anne Donohoe, and she is also going to be speaking about our graduate diploma level 9 programs. Then we're going to pass over to our Associate Professor Denise O'Brien, who's going to speak briefly on the midwifery programs available at top graduate level here in the school. And then we'll have Dr. Sean Paul Teeling, who will speak to our health systems programs. Then we will have Dr. Deirdre O'Donnell and Dr. Carmel Davies to speak briefly about our master's programs, which would be an introduction to dissertation options. So those are for people who have a level 9 graduate diploma program already and are considering doing top-ups to receive their full masters. Then we'll move to speaking about our Masters by Research and our PhD programs, and then finishing off with Sean Kenny here, who will speak to you about the application process to UCD. So without further ado, I'm going to pass you over to Dr. Anne Donohoe. And just to repeat, if anybody has questions throughout the session, my lovely colleagues here, Nicola, Marta and Sean, are going to be manning the Q&A function. So we would ask, if you do have questions throughout the session, to put your questions into the Q&A function, and the answers to your questions will be dealt with. So Anne, over to you.
Thank you very much, Emily. I just share my screen now and you can let me know when you can see my screen. Okay, can you see my screen now?
That's okay, Anne, yeah.
Okay. Hello, everybody. I'm delighted to be with you this afternoon. As Emily said, my name is Anne Donohoe and I'm the Associate Dean for Postgraduate Studies here at the UCD School of Nursing, Midwifery and Health Systems. And for my talk this afternoon, I'm going to concentrate on 3 primary areas. I'm going to present a very brief overview in terms of what UCD is, the college, what it is about. I'm going to provide a brief overview on the UCD School of Nursing, Midwifery and Health Systems, and then I'm going to provide a detailed overview of our thought graduate suite of programs. So in terms of UCD, it was established in 1854. It's a very large college. It has over 38,000 students from 152 different countries. It has 6 primary colleges with 37 different schools and a variety of centres, research centres within that. It's a high-ranking global university. And our motto is Ad Astra Codrum na Fena, which means to the stars, justice and equality. And the campus itself, it's over 230 acres located on the south side of Dublin. And it's a campus that embraces an ethos of equality, an ethos of diversity, an ethos of inclusion. So there's space for everybody on the campus, and it really is a university for all. We have state-of-the-art teaching and learning facilities, state-of-the-art technological facilities, and state-of-the-art library facilities. So everything that you could want on a university campus is available for you here in UCD. It's a lovely place to study, it's a lovely place to work, and it's a lovely environment to be in and to be part of. Located within that vibrant campus is the UCD School of Nursing, Midwifery and Health Systems. And perhaps a lot of you are already acquainted with it, but it's the largest and indeed the oldest School of Nursing and Midwifery in the country. And it has the largest thought graduate offering of programs in the country as well. And we have over 800 students in that thought graduate space alone. We offer over 45 different graduate offerings. In the CPD space, that's continuing professional development, we have over 150 students in CPD, and we offer a range of 46 CPD programs, and that's in partnership with our clinical partners. And I'll talk a little bit more about those in a moment. Again, our school, our UCD School of Nursing, Midwifery and Health Systems, has state-of-the-art teaching and learning facilities. It's a very teaching-intensive school and a very research-intensive school. It's a very vibrant place to be in, a very vibrant place to be part of. Now, this is probably the most important slide that I'm going to share with you this afternoon, and it's the Thought Graduate Programme Suite. And this is really the gateway into the Thought Graduate Programmes. So if you type Thought Graduate Programmes, UCD, School of Nursing into any browser, you will come onto this page. And from there, you'll be able to navigate into our various areas. And we have 15 broad areas for Thought Graduate Programmes. And they range from acute and critical care nursing to advanced practice nursing to cancer nursing, children's nursing, chronic care, CPD, gerontological nursing, health professions education, leading, innovating, managing, mental health, midwifery, palliative care, prescribing medicinal products, public health and community nursing, radiology and imaging nursing. So as I say, 15 different distinct areas, and you just click on your chosen area, and that will bring you into a second page, which will identify the master's pathway, the graduate diploma pathway, professional certificate pathway, etc., etc., etc. And once you click further into that, then it will tell you, will provide more information on your particular area of interest, your particular course of interest, what you will learn, the names of all the modules, the codes of all the modules, fees, funding, scholarship, entry requirements, who should apply, etc., etc., etc. So there's lots of information available on our website. So your starting point for Thought Graduate is the Thought Graduate page. To pursue a master's program here in UCD, you need to have completed a graduate diploma of 60 credits. Before you can progress to a master's program here in UCD, in the School of Nursing, Midwifery and Health Systems. And I know our speakers later on today will tell you a little bit more about that. So as I say, your starting point is this page here to have a review of our 15 different areas, and you can click into your particular area of interest or your particular area of choice. We have a tab for frequently asked questions, a tab for awards and scholarships, and additional student support. So there's lots of information on our webpage there. Now, we couldn't do any of our work without our links to our clinical partners. And so I'm sure some of the audience here are already working with our clinical partners or know our clinical partners particularly well. And we're developing clinical partners nationally on a continuous basis, but these are our primary clinical partners. St. Vincent's Hospital, the National Maternity Hospital, Our Lady's Hospice and Care Services in Harold's Cross and Blackrock, the Mater Hospital, St. John of God Hospital, Children's Health Ireland at Crumlin, Children's Health Ireland at Temple Street, Health Services Executive, and that's primarily for our community placements and our public health nursing placements, and the Mater Lean Academy. Now, I know we've spoken today about over 800 students in the Thought Graduate space and at the largest Thought Graduate offering in the country. But just to reassure our potential students that it is very much a UCD family. You will be joining our UCD School of Nursing, Midwifery and Health Systems family. And you will do cultivate an ethos of belonging. And that's very, very important to us in the Thought Graduate space. Every program is a named program director. You'll know your program director very well, and they will get to know you very well. Every program is a named program administrator, and we have a range of UCD academic and student support systems within the college as well. But just to remember, we do really cultivate that notion of belonging, and I don't want people to feel daunted by the fact that we do have a wide range of programs, and you will become part of our UCD as family, as it were. And we have had students in the past who started with us at undergraduate level, progressed to master's, progressed to PhD, and are now part of our faculty. So if you want, and I know I've provided you with a lot of information in the last number of minutes there, but if you want any additional information on our school, you can click onto our UCD School of Nursing, Midwifery and Health Systems webpage. And if you want particular information on our graduate programs, well, then the link is there for you, and that is there for you in the chat as well. As I say, this is probably the most important slide, the most important page for you. And you can navigate your way there from there to your particular area of interest. If you have any questions, just type them in the chat, and we have our excellent administrative staff there who will answer your particular question. Remember, there's no question too small. Any question is welcome. So that brings us, as I said, to the end of our thought graduate programs. These are our particular areas, and I'll hand you now back to Emily. Thank you, Emily.
Van. So I'd like to introduce our Associate Professor, Denise O'Brien, next, who's going to speak briefly about our midwifery programs on offer here in the school.
Thanks very much, Emily. I'm delighted to be here and welcome to any of the midwives that are on board on the webinar. You're very welcome. So I'm just going to do a very brief overview of our midwifery graduate programs here in the school. So midwifery is, sorry, I was pausing there for a sec. The midwifery profession is a very relationship-based profession, and our programs are developed in a way that really we are teaching. Our whole philosophy around our programs are to meet that need, that relationship-based professional with shared decision making. It's all about the woman and her relationship and as a family unit, and really that set in a contemporary fast-paced maternity environment is not easy. So we've developed a suite of programs to address that need. So our graduate programs, and I'll put this link into the chat for anyone who's interested. We have had some interest, somebody who's attending the webinar is interested in the higher diploma in midwifery. So just to say that program is an 18-month program. It's available to all qualified nurses who are interested in becoming a midwife. It runs literally every 18 months. There's 25 places, and generally your placement would be in the National Maternity Hospital. It's a fantastic professional program to do after nursing. And if you want to put any questions into the chat, I'm very happy to answer them. In terms of our graduate programs, we have a master's program in advanced practice, and we have 3 professional certificates that I'll go into now. Professional certificates are 10 credit programs that can be used as part of the advanced practice. But also, not to forget, when we're talking about graduate, and somebody will speak in more detail about our research degree programs, but just to say that for midwives, there are also a PhD program, which is available full-time for 4 years or part-time for 6 years, or a master's by research, which is a fantastic program over 2 years. And these are really good programs to undertake as part of professional development. So back to the prof certs. So there's 3, and these were all developed. There was a request for them, and this one is really, really good, and there's a lot of interest. So what I would say to you, if you're interested in any of these professional programs, do apply early because they fill up fast. And this one in particular, so this is an annual program run by my colleague Denise McGuinness. It's fantastic, level 9, 10 credit program, and what it does is it prepares participants to be lactation consultants. It's approved by the Nursing and Midwifery Board of Ireland, and it really does, it's open to all healthcare professionals, whether it's nurses, midwives, public health nurses, or GPs. And the link there, again, I can put it into the chat, will give you all the information about the program. Mainly blended, that program, with 2 days on campus in UCD. Maternal critical care, that didn't run this year, but it will run next year. This program was designed, actually, it was the directors of midwifery contacted us and asked us to develop this program because there was a clear need. And this is because, unfortunately, there is a lot more high risk associated with pregnancy and childbirth. And this program provides midwives with a program that enhances their critical thinking and to provide specific care for high-risk women in high-risk maternity care and settings. So that's another option. And then those can be used and taken as part of our advanced practice program. So this is the program that I'm the program director for. This is a nursing and midwifery board approved program. If you take this program, you become a RAMP, registered advanced midwife practitioner. And registered advanced practitioners really lead out an innovation, development of clinical practice in midwifery, and they practice to their fullest capability. The advanced practitioner is a really strong voice for the profession. This program runs over 2 years. You can take it in 1 year. I don't know anyone who's done it yet. It's a lot of work to take on the year. It's a 2-year, 110 credit with 500 hours of clinical practice. And usually what happens is you apply, and again, this one apply early because some of the modules are shared with nurses, and no offense to the nurses, but there's a lot more advanced practitioners in nursing. And there is limited places for the advanced health assessment, for research. So in terms of midwifery, we have 10 places for this program, but midwives do tend to apply later and unfortunately have missed out on places. So back to the program, this program is very suitable for anyone who wants to lead out in normal midwifery care, whether it's setting up midwifery-led services in their own hospital that they don't exist, whether they want to be an advanced practitioner in diabetes, advanced practitioner in hydrobirth, water birth, home births, a complicated pregnancy. There's huge potential for this one. You just literally have to create that innovation in practice, bring that to the director of midwifery, and then apply to the UNMSD for funding and secure a place on the program. It's well sought after, well developed in UCD, and there is actually, we've created, with the help of Emily, our marketing manager, we've created a YouTube video, and I've just put that down. Do look at that if you're interested in this program. All the information is there. So this is the link that I'll put into the chat, and that again will give you all the information about the program. And our final Prof Cert, the examination of the newborn. And just to say, those three, I'm giving you a lot of information, but this is recorded, thankfully. There's 3 Prof Certs. All of those can be taken as part of the advanced practice program. You can use these 30 credits as part of your 110 credits for advanced practice. So again, this was developed, it was the first of its type in Ireland. There's a lot of demand for this program, and this is to give you the knowledge and capability and clinical competence to complete examination of the newborns. So it's a new scope for midwives. We introduced it in about 2016. The next intake is for 25-26, and this program is led out and developed by my colleague Liz Green. And it's really, really good program. It's very clinically focused. You can see there's 30 clinical assessments, very similar to the Prop Cert in maternal critical care and lactation and breastfeeding. There's a lot of expertise and new knowledge with a clinical component. Thank you. A very quick whistle-stop tour. Any questions, put it into the chat and I'll share those links. Thanks, Emil.
That's wonderful, Denise. Thank you so much. That's really given us a good overview of the midwifery programs here in the school. Hopefully we have some of our midwives on the line, as you said. So I'm going to pass over to our next speaker, and that's Dr. Sean Paul Teeling. And Sean is going to speak to us about the health systems programs here. So Sean Paul, it's lovely to have you.
Thank you very much. Thanks, Emily, and thanks, everybody. And I will stick to time. Thanks, following Denise's there. Thanks very much, Denise. So thank you for the invitation. Delighted to be here on behalf of my colleagues in UCD Health Systems to present some of our programs here. I'm going to specifically talk about our an orientation to, I suppose, our leadership, innovation and management pathway programs. So these are for postgraduate students, obviously working across all disciplines. I think it's one of the unique selling points that we have within UCD School of Nursing, Midwifery and Health Systems is that we actually have interdisciplinary programs. So on our programs, we have doctors, nurses, physios, OTs, you name it, speech and language therapists, dietetics of our graduates. We also include on that, though, healthcare staff who are non-clinically facing, such as HR managers, operations managers, administration team managers, medical secretaries, porters, plumbers, you name it. So you could be in a class of a diverse collective of people who work across the healthcare system. And of course, the real thing that we're getting across in our health systems module is that everybody's involved in healthcare, and healthcare is everybody's business. So really just to give you a quick overview of our modules, the MSc Lim is 90 credits for a master's, and starting off with the master's, you can start off with a 10 credit module. That's called a Professional Certificate in Process Improvement in Health Systems. That runs for 6 months, and you can take that starting off. You can also, if you decide, do that as a standalone qualification, which sometimes in healthcare, in the HSC or in the World Health System is called a green belt, but it is a module component as well of our overall masters. Then you can get 30 or 40 ECTS credits for our graduate certificate in strategy, leadership, and innovation in healthcare. For those of you who are in management or operations, a graduate certificate in quality in health systems. And again, quality improvement is everybody's business, as you know, it's becoming more and more. And then graduate certificate process improvement in health systems, which has a large focus on person-centered approaches as advocated by the IHI and the World Health Organization. You can then build up to 60 credits to graduate diploma leading and innovating in health systems. And then you can cap it off then to have your MSc Leadership, Innovation and Management for Healthcare. So these can be taken as individual qualifications, or you can apply for the master's, or you may do, for example, a 10 ECTS credit now, and 2 years' time decide you want to top up to a master's. But you have 3 years to complete the master's in that time frame. So it is quite user friendly. If you, for example, had any family or life instance where you need to take a break, you can stop and come back. Our teaching learning approach is very much blended learning. The modules are mostly or wholly online. However, we do have required attendance because some of those modules, or actually a lot of our modules, have very interactive team-based learning and student-led presentations and seminars. There is continuous assessment, and not only of learning, but also as and for learning. But there is very much an application to real-world settings. It's interdisciplinary, as I said. It's about systems thinking and design thinking, about person-centeredness. It's about awareness of self, purpose, team, and context. It's about your personal resilience. It's leadership as primarily relational. And there's an emphasis on using theories and concepts to make sense of past and current experience of the students, yourselves, and to generate alternative ways of being, thinking, and doing. These are our component modules. So you can see you have quite a smorgasbord, for want of a better word, of really innovative approaches to healthcare. You've got global health, health systems and health policy, collective leadership. You can see just there, I won't go into them in detail because of time, but there's a number of component modules to each of our overarching programs. And really, for example, we have quality and patient safety. My colleague, Professor Aoife de Bruin, leads on this. And this is about patient safety, the theories and methods behind that, and developing skills in that. Another example module will be strategy and innovation in health systems, which is taught by my colleague, Professor Martin McNamara. And this is really about seeing yourself as a strategist, I suppose, and an innovator, and thinking about how organizations manage strategy and innovation. And this very much ties into, you'll all know about improvements and lean in the healthcare and the HSE, but also about innovation, such as spark innovation. So it's building on everything that's current in the health system. Then my colleague, Professor Eilish McAuliffe, teaches on collective leadership and effective teamwork. And of course, all of these modules are underpinned by effective teamwork. So this is a fantastic module as well, with a plethora of resources related to that in the collective leadership website as well. And then there's the module which I teach, that 10 credit module, which starts off, which is about improving processes in the health system. And this is about looking at systems as they currently work, realizing that they don't work, and we either need to build a new system, which is process design, or we need to redesign the system we're currently working in. And again, like most of our modules, there's team-based learning, so you'd work together in teams to develop solutions to some complex problems. And my final slide is basically to say that from our health systems offering, we have over 100 publications with our students that are co-designed by our students, multiple conference presentations. Our students are presenting in Queen's University, they're presenting in Stanford University, they're presenting all over the world. And you can see here we have some of our winners, some of our doctors, some of our nurses here, and the teams are multiple and diverse. So I suppose if you're interested in working in an interdisciplinary and multidisciplinary health system, and you want to start developing your skills to lead, to innovate, and to improve, well, then this would probably be a master's, or some of the component modules would be of interest to you. Hopefully I haven't run over time. Thank you, Emily and colleagues.
Thank you, Sean. We've been all very good. Sean Paul, you've ran through that so quickly. We're actually ahead of time now, believe it or not.
Oh, great. Okay.
Yeah, no, that's absolutely wonderful. And it was wonderful to be part of the Lean Healthcare Symposium that you held last week. Wonderful conference, really, really interesting. And it's something I would recommend any attendees interested in the area should look into it, shouldn't they, Sean Paul? 100%.
Absolutely. You're welcome. Thank you.
Great. Okay, so we're going to pass over now to our next speakers. So I'd very warm welcome to Dr. Deirdre O'Donnell and Dr. Carmel Davies, who are going to speak to us about introduction to dissertation options, how you can top up your existing maybe graduate diploma program to do your master's top up. So I'll hand it over to my very capable colleagues here.
Thanks, Emily. I'll just share slides here, and I'll go through the slides, and Carmel will chip in as and when needed. So thanks very much. Let me just put it up here. There we go. Now, is that sharing now full screen?
Yeah,
Great.
all good.
Great. So as Emily said, this is, I guess, the top up 30 credit module that would kind of at that converts your graduate diploma, etc., into a MSc or a master's or graduate master's program. So, and what this module is called is the Evidence Synthesis and Translation. Myself and Carmel share the coordination of the module. And it involves the production of a master's dissertation or a minor thesis, a graduate taught minor thesis. As I said, myself and Carmel are the co-coordinators, and the module is very heavily supported by academic lecturers who act as supervisors for students undertaking the dissertation. So just a quick background to the context for the module. So as I said, it is kind of grounded in theories of evidence-based practice and policy making in healthcare, which describes clinical practice and health policy that's grounded in the best available evidence. By that we mean research evidence or empirical research evidence, obviously involving the consideration of preferences and consideration of the preferences of patients and clients, as well as professional knowledge, clinical knowledge and practice, as well as integrating that with policy context. So why do we practice evidence-based practice? Because we know it leads to the highest quality of care with best patient outcomes, reduces healthcare costs, reduces variation and introduces geographical standardization of care. Clinicians feel more empowered and satisfied in their roles. We know also that patients and clients want the best evidence supporting their treatment. So I guess this module is rooted in evidence-based practice models and theories with the aim of supporting students to develop their skills and knowledge of how to become evidence-based practitioners and policymakers. We focus on principles of evidence-based practice and with a particular focus on the context of evidence-based nursing and midwifery practice and evidence-based health systems design and development as well. The module aims to support students in developing their knowledge and skills for evidence synthesis and importantly, translating evidence or knowledge about evidence and synthesis of evidence into practice and policy. So just a quick overview of the module structure. So it is a year-long modules delivered over 2 trimesters, the autumn and the spring. The module is results in 30 ECTSs, which equates to between 600 and 700 total learning hours. So that's learning hours, which combines obviously the contact time with the module in terms of lectures, seminars, group work, as well as autonomous learning. The module is delivered through the Brightspace virtual learning environment in UCD. We adopt a blended approach. There are 3 in-person lectures on Monday afternoons in each trimester. So that's 6 in-person lectures across the module in the 2 trimesters. This is supported by online seminars, roughly about 4 online seminars in each trimester as well. And then there's very highly structured autonomous learning. We support that learning with worksheets, pre-recorded mini lectures, readings, peer-supported discussion forums, as well as there's a module handbook and guidelines as well. In the second trimester, students are allocated an academic supervisor who supports the development of each of the chapters of the dissertation as well. We really try to underpin our approach to the learning strategy in this module with kind of evidence-informed instructional design. We try to create a very vibrant social presence for students, even though it is a blended module, as I said. So there is quite a lot of online content, but we really try to create a very vibrant sense in the module. And we do that through our face-to-face sessions as well as our live online sessions. We have peer support discussion forums. We run virtual drop-in clinics as well. We have a very structured approach to the module, so it's very much weekly incremental learning. There's weekly units delivered for each student with very clear goals about what the learning outcomes for that week are and checklists for them to monitor and self-evaluate their learning through the module. It's very much focused on being very grounded in real world experience. So we're working, we know, with highly experienced practitioners, nurses and midwives coming from the system designers, administrators, etc., with so much experience of the real world of healthcare in Ireland. And we try to keep the module content very grounded in that real knowledge and try to see how we can use evidence to support the evolution of practice and system design as well. So the dissertation steps really echo the the 6 evidence-based practice steps, or the 5 A's of EBP. So we encourage students to assess their practice or policy context as the first step to really identify what the knowledge gap or practice or policy gap is that they wish to address. We support students to ask a very structured evidence-based practice question using structured question templates. Students are then supported to develop a systematic strategy for finding and acquiring the best level of evidence to address that knowledge gap or practice gap. They then appraise that evidence and then consider how that evidence might translate to innovations in practice and policy relevant to their own practice and policy experience. The teaching and learning strategy for the module, as said, it is a blended approach. But the students are very highly supported through this dissertation module. There's peer support that's facilitated through small group work, and myself and Carmel as module coordinators would be very involved in setting that peer support up. We run synchronous seminars that would be both in person and online, and that's very much focused around conceptual development and methodological support for the module, for the dissertation. There's autonomous, as I said, learning, but that's very structured with lots of resources to support students in developing that autonomous learning. And there's academic supervision as well. And then finally, the assessment. I know students are always interested in assessment and the assessment approach. So the assessment, there's 2 assessment approaches for the module. There's a formative assignment in the autumn at the end of the autumn trimester. So that involves a 2-minute pitch of their research idea to their program director, where they get really great kind of immediate feedback to support them in particularly identifying that policy or practice gap that they wish to address. Then there's a written assignment at the end of the autumn trimester, which is again formative and very much geared towards supporting students in the development of their chapter 1 and 2. So that formative assessment is worth 10% of the overall grade, but students really, it's not really about the grade, I think, for that one. It's very much about the structured feedback and the support and the formation that they get through that assessment. The dissertation then is the main component of the assessment that's due at the end of the spring trimester, worth 90% of the overall grade for the module, assessing all of the learning outcomes. So that is a 10 to 12,000 word dissertation structured over 5 dissertation chapters. The supervision is really important there. Students get an opportunity for one-to-one feedback from an academic supervisor for each chapter that they're developing in their dissertation. So that is the overview of the dissertation module. Emily, I don't know if there's any specific questions, or I'll stop sharing here, or if we can take them at the end maybe.
That's wonderful, Deirdre. Thank you so much for walking us through that. I suppose if someone was, after listening to your presentation, if someone was to take away kind of 1 or 2 key things as to why they should consider doing their master's dissertation, what would you say to a student? maybe do you have an example maybe of a student or some feedback that maybe a student has given to you as to how this has helped them develop, probably both professionally but also personally?
Put me on the spot,
Yeah,
Emily.
sorry.
Do you know, the feedback that we get from students, and I might invite Carmel to come in. I think that we've had feedback from students who have undertaken research modules before at undergraduate or at talk graduate level, and this is maybe the first time that they really felt that the value of research and could see immediately what research means for them in terms of their professional development, in terms of the development of their career and their profession. And it really, I think, closes the loop for a lot of them in terms of that research training they may have had, whatever experiences they may have had of research before, and suddenly being able to see what the value of that might mean for them in their career and in their profession as a nurse or a midwife or as a leader within health systems innovation and practice innovation as well. I think that's one really strong feedback that we often get, Carmel. I think you might agree with that.
Yeah, I think that's a fair point. And I think as well, students like to see that the module is very grounded around the national competencies around clinical effectiveness, which is the competencies with asking research questions, evidence synthesis, evidence translation. And I think sometimes they come into that module with looking at some of those kind of national documents, and they go away very much feeling they actually have developed the knowledge and skills. So I agree with Deirdre. I think merging all of that, usually students come away feeling a real appetite, and many of our students do go on and do the Masters in Research and go on to PhD, yeah. But more importantly, they go on to understanding that this is an everyday practice within improving patient care, and that they are active in research in many ways within their practice setting.
Cool. I hope that's inspired a few people. It's certainly inspiring me. So thank
very
you
welcome,
both.
Emily.
So I would like to hand over to our next speaker. So I'm delighted to welcome Professor Karina Naughton, and you just mentioned, Deirdre, about the Masters by Research, and Carmel had mentioned as well, progressing on to, I suppose, that next step. And Karina is going to speak to us briefly about the Masters by Research and then also our PhD program offering. So is Karina on the call? There we go, yeah, Karina. Hi.
Yeah, I'm just trying to bring up my slides. I'll have to open it up again. Okay. Yeah, no, good afternoon, everybody. I was ready a few minutes ago that I started looking up something. Just let me bring up my slides here.
So everybody, just a reminder to put any questions that you have in the Q&A function. I can see some questions have come through already, and our colleagues there, Sean, you've been answering a few there, so thank you so much. If there is any, as I said, you can put those into the Q&A function. Another great resource as well for anybody attending. There's a lot of information to absorb. We do have the largest talk graduate offering in the country. We have a lot of programs here in the school, and I really would encourage everybody to have a look at the school website. If you just Google UCD Nursing, our website will come up in Google, and you can go in there and you can read a lot more detailed information about each one of the programs that may be applicable to your particular career trajectory. Okay, Karina, I can see your slides up there now, so I will hand over to you.
Emily, very confidently done. Thank you.
That's all right.
Okay, so everybody, you're very welcome to meet with us this afternoon. So without any further ado, so really I'm going to talk about the PhD and the Masters by Research pathway, which, you know, up until now you've had that graduated approach from the kind of singular module up to the graduate diploma, up to the Masters. And now you're kind of coming in at the kind of very, I suppose, pinnacle of education in terms of this is the highest level that you can go in terms of a structured education. Okay. So just putting that into context, we started off down here kind of with the graduate diplomas, and this is the National Quality Frameworks. So a Masters by Research is in here level 9, and a PhD is at level 10. So that's the highest structured education you can attain. So the question is what's the, Deirdre partly answered this already. that distinction between what's a structured master's, as Deirdre described, and a master's by research. They're, in terms of educational attainment, they're both at the level 9. The difference with the master's by research is that you are primarily undertaking your research, developing your research experiences and education through undertaking a particular piece of research. Okay, so the difference between the two of them is that you are doing research, you will be collecting data, analysing data in a master's by research. Registration, and it is very much about you developing your research capabilities in an applied way. And the kind of the distinction is that it is about developing those skills, and it may, but does not necessarily result in the creation of new knowledge. I want you to kind of hold that idea. What's this idea of new knowledge? As I said, it's based on a defined project. It may or may not involve some structured modules, and that's kind of your conversation that you have with your supervisors. You are allocated a supervisor from the very outset in a master's by research. Full-time, it's 1 to 2 years. Part-time, it's 2 to 4 years. And people on the master's by research have the option to transfer to a PhD. So students, you still create publications, you still create outputs. So the master's by research is that very much applied skills learning. Okay, so if you've decided that you actually want to take it to a step further, then you would consider a PhD. So a PhD is at level 10 of the Ireland's National Framework for Qualifications. This is one of the kind of key distinctions between a master's by research versus a PhD. It's to educate and develop researchers to the highest skills level so that they can become creative, critical, and independent individuals in terms of research, and to advance the boundaries of research. So it's kind of a higher stakes undertaking. Your research, your PhD journey is centered around a coherent body of research or project which forms your thesis. The duration is 4 years full-time or 6 years part-time. You are allocated a supervisor from the very, very beginning. So this journey you undertake with one or more supervisors. There's generally a primary supervisor and a co-supervisor. There are some structured modules that you do as part of the PhD journey. And your output is this very substantial thesis between 80 and 100,000 words. So it's that's what you will end up with after 4 years. But the doctoral program is not just about the dissertation, it's not just about the thesis, it's about the research skills, the original contribution to knowledge. You've developed your skills around ethics and social understanding, personal effectiveness, transferable skills, team working and leadership skills, communication skills, entrepreneurial and innovation skills. And sometimes we don't really talk about those too much in the PhD, but they're absolutely an expectation is that it's not just research skills, it's much broader than that you acquire through the PhD program. Okay, so finding out information about the PhD program, we can send out these slides afterwards. Your starting point is the Graduate Studies website. If you're thinking about a PhD, you're at the very early stages here. So you're needing to determine your area of interest. So what is it that that you feel merits 4 years of your time, energy, and effort? So it's something that you have to be quite passionate about. Your next step is to identify a supervisor within that topic area. If your English language skills, then that's another requirement. If English hasn't been your primary language. So once you kind of get through there, so a topic, it's supervisor, then there's a formal application process. And this is where I suppose some of the things you have to consider for a PhD is where is the funding going to come from? So within our school, if you're wanting to undertake a PhD within our school, then the first place I'm going to direct you to is our school research website. So that's what you will find that in that website, you will know what is it that are our topic expertise. What is it that our faculty are particularly strong in, and you have to align with supervisors that have your topic expertise, methodological expertise. So really your starting point is to find out what it is that we do and we do very well. So we've got the Centre for Interdisciplinary Research, Education and Innovation. So there's a group of researchers who work primarily within that space. We've got an aging and long-term conditions research cluster. We've got a maternal and child health cluster. And we've also got, actually that has to be updated, clinical practice development education. It's really kind of nursing workforce and nursing innovation. So go to the website, see who's doing what, and how does that align with your particular topic expertise or the interest that you want to do your PhD or master's by research in. On the website again is the kind of the specific site that's dedicated to the PhD students. We have nearly 70 PhD students in our school and about 10 masters by research. So certainly the PhD, they are the dominant group. So the really nice thing about it is that there's a really good community. There's really strong peer-to-peer support. And while the PhD is about your thesis, it is your journey. It's not a journey you take on your own. There are several other people on the same pathway as you. One of the things you have to particularly think about for a PhD is where you're going to, or Masters by Research, is where is the funding going to come from? You can be self-funded or employer-funded. Really, the fees are quite substantial, so that's not really, your self-funding can be a very tricky option. Employer-funded is certainly a more stable route. In the school, each year we make a number of PhDs scholarships available. This usually comes up onto our website about March. And what we do is we waive the PhD fees, but there are no stipends. There's no additional extra money. So that's our model. But certainly waiving the PhD fees is very substantive. This year, there's going to be maybe a little bit more of a change in how we structure the PhDs. We are very much going to be looking for topic-based PhDs, and we're going to propose those topics so people apply underneath a particular topic. Okay, so that might be, your topic could be dementia, or it could be heart failure. So, or it could be simulation. So there'll be a range of topics that we will advertise, and people will be expected to complete basically an application, a proposal. So the title, background, all of that kind of information that you would write as part of a research proposal. Ideally, you're kind of working on that with a supervisor from the school. That's not something that you're doing on your own. But so just really kind of at this stage, all you really need to know is if you're interested in doing a PhD within our school, look at our website come March. Thinking about a project proposal, we'll put up those project topics quite shortly in our website. Other places where you kind of need to think about funding are the Irish Research Council. That's currently closed for this year, but that will come around each year. The other place is the HRB Sphere program. Okay, so I'm not going to go into those in much details. The links are there. So that's, you've had a lot of information this evening. So really, if you are interested in a PhD, undertaking a PhD or a Masters by Research, contact Myrta, who kind of administrates and supports this program, or contact me, and we can kind of talk about your interest in this area. And I can also kind of point you to kind of potential supervisors. So thank you.
Great, Karina. Thank you so much for that. It was a really good overview and a lot of information, as you said, for those who are interested. The scholarships, I think, is really a key one, and it's something that we've been building upon year on year as a school. So it's wonderful to see that these will be continuing, and hopefully we can have many more students studying. research programs here in the school. Okay, so we have our last presentation now. My colleague Sean here has been waiting very patiently. I saw you were a busy beaver on the Q&A function, so thank you so much for your support there, Sean, and also to our colleagues Nicola and Marta who've been answering questions. So I will hand over to Sean. Sean is going to give us an overview of the application process to UCD. You've heard about a lot of programs here, and I suppose if you are interested in proceeding, and these will be the next steps, and Sean will show you this with a couple of screenshots as well, which hopefully will be useful for you.
Brilliant. Thank you very much, Emily. Everyone, so just give you a very, very brief rundown of the application system and how you can apply for any of the programs here in our school. So the good news is, as my colleague Emily mentioned, we have a huge range of courses available in our school, and the good news is that these are all centralized here in our UCD course catalog. So once you find or you have an idea of a course that you feel that you'd like to apply for, you can search through the course catalog and it will bring you here. Once you click on apply on the particular course you'd like to join, this will loop you back to the website, and this gives a full breakdown of the course. So it gives details on the fees, gives details on any requirements, modules, assessment, who this particular program might be for. So it gives you a full breakdown of everything rather than giving you a huge information, and it's all connected as well. Once you are happy that you'd like to apply for the program, you'll be directed to the login page. So if you've never been a student of UCD before, all you need to do is create a profile. I've done that process myself. It takes about maybe 2 minutes to do. It's just really to create and set up a password, and your application then will be waiting for you. Now, the very good news I have for that is that we've recently updated our application system here in the school. It does make it, firstly, a lot easier for you to complete your application. So you'll see here, this is just a brief screenshot of the application system. So it lines out that there's 9 parts of your application, and it won't let you proceed until each task is completed. And it allows you then as well to track and see how your application is going. And what it also benefits is that it allows you to have your application completed and get a decision on your application much faster as well. And you'll also have an automatic email at every time that a stage in your application is reached, whether it's a conditional offer, if it's a full offer, or if there's something missing or anything. And there's contact details there at every stage as well for you. So I've completed just as a test for a part here. So it'll show you each time a green tick when every stage or part of your application is completed as well. And just a really brief rundown, but as I said, as my colleague Anne said, there's no question too big or too small. So please, do feel free to contact us if you have any questions at all. I'll put the link into our connector here in the chat as well for anybody. As I said, there's a huge range of programs, but each program has a dedicated administrator. So this connector will actually put you in touch with the right administrator for the program. That's everything for me. I'll stop sharing.
Thank you, Sean. I guess one takeaway I always take when we speak about the application process is, if you've been a student in UCD, don't create a new profile to apply. It causes a lot of issues later down the line. If you have forgotten your login details, you can go to that contact us form as well, and I'm sure one of the colleagues can point you in the right direction to get that. So yes, that's one very important takeaway, because I know from my colleagues here in the office that can cause some headaches having multiple profiles. So thank you so much, Sean. Hopefully that's given everybody an overview of how you can apply to UCD. I'm just wondering, is there any difference in terms of applying for the PhD programs? I know Karina mentioned it briefly. There's a few extra steps.
Really, the PhD program sits kind of outside of the other structured programs. So it's really, if you're applying for one of our scholarships in March, then it's really about submitting that proposal. And from there, if you're accepted onto the PhD program, then Marta takes over with your registration for that. But the first step is really completing we'll put it up online, but it'll be basically a proposal, a research proposal application. Yeah.
Okay, so if anybody has some follow-up questions about that, they can get in touch with yourself or Marta after the fact. Okay, great. So we're nearly on the hour, so we're right on time, Anne. So I'm going to pass back to Anne now, and just to any closing remarks. If there is any outstanding questions, please do get those in now, and we will hope to answer those before we close off the session. As I said, the session has been recorded, so we will issue this to all the registered attendees, and you will see many contact details within that. And just, yeah, Anne, I will pass you over to do final remarks and thank yous.
Okay, Emily, thank you very much. And I'm just going to conclude with some thank yous. First of all, a thank you to each of our speakers. It was a very interesting hour. I know we covered quite a lot of material, but I could just reassure everybody by saying the information that we've shared with you is on our website, but please follow up, as Sean has said, with our contact form. We're happy to address any question that you have. So please contact us. That's probably the first take-home message that we have for you. So I'd like to thank, as I say, all our speakers. I'd like to thank everybody who attended as well. And I hope that you found the session informative. I'd also like to thank Emily, who has worked feverishly there in the background, organising today, and also being a very good host for the session today. And I would also like to thank Myrta, Nicola and Sean, who've been working in the background there, answering all of the questions. So as I say, I hope it gave you food for thought. Please keep in contact with us. Please ask any questions that you have. And we're really looking forward to seeing you, hopefully in September, to start your next phase of your educational journey with us here in the UCD School of Nursing, Midwifery and Health Systems. So I'll hand you back to Emily to close. And thank you very much.
All right, thank you so much. I can see just a final question being answered in the Q&A, so I'm going to allow that before we close. But just to thank everybody, and we hope you have a lovely evening wherever you are.